in the presentation, I wanted to talk about Social Security disability benefits, for example. I wanted to talk about the difference between those. A lot of people don't understand yet what is Social Security disability insurance, what is Social Security insurance, what qualifies me for what is Medicare, what is Medicaid, how can I qualify for Medicaid, programs under Medicaid, long-term care planning. So all this is part of what I have planned to discuss with all of you today, as well as specific resources such as home care, respite care, case management services. Uh, uh, so all of these are topics that I have planned to discuss with you. But what if I was to just open the floor to questions? Will that work for you? Will that be best? Because I'm sure we have different levels of MSA, people with MSA at different levels, different stages here, and caregivers caring for people at different stages. So will that work for you?
Could you tell us a little bit about home care? You mentioned that.
Yes.
Maybe you can mention some of that.
Yes. So for in terms of home care, I think one thing that is important to know is a lot of physicians, when you go to the physician office, they tell you, get some home care services, and I write a script, and you can get some home care services, so Medicare can pay for it. One of the things that is tricky about that is that Medicare actually doesn't pay for home care services unless you are getting a skilled care at home. So, skilled care, what I mean by that is um, you need a nurse that's coming in to check your blood pressure or vital signs, or somebody who's doing medication management, or you need physical therapy, occupational therapy, speech therapy at home. If you're getting those services at home and you are, because you're at this point homebound, then Medicare can cover for some home health aid care. It's not a lot. Don't expect to get, you know, 8 hours a day. It's going to be very limited. So you need to take into consideration that for services such as home care, when you're thinking about long-term care planning, a lot of this is going to be an out-of-pocket expense. Unfortunately, it's really not. It shouldn't be this way because it's absolutely necessary, especially in cases with chronic diseases such as MSA. But it's important for you to know so that if you go to your physician and so that you are aware that it is not an option unless you're getting PT, OT, or something like that at home. In terms of how to pick a good home care provider, I hear that a lot of, that's a question that comes across a lot. There is a website, actually. I listed a lot of websites in my presentation. I know you guys are going to get this. And they have actual questionnaires or specific questions that you should ask a home care provider when they come into the home to make an initial assessment, so that you're looking for the right match for you. Be prepared to not to have high expectations, in the sense that the first person that is going to come home is going to be the person for me or for mom or for dad or whoever you're caring for, if it's not you yourself who's picking the home care provider. But you really need to find someone that's going to be good, not only taking care of the physical aspect, but somebody that's going to click, in a personal level with you. So give yourself time. That's something about home care, is that it's important to begin to plan for it ahead of time. Don't wait to pick a home care provider when you need it tomorrow, if you can. If you don't need it right now, at least begin to interview some agencies out there, begin to talk to family and friends about who they can recommend, so that they can so that you can make a slow and decision and informed decision about who you want in your home. Any other questions about home care? And then the reason why I put case management here with home care services is because case management services can also be very crucial, and when you are trying to plan so many things at a time. A case manager, you can find one through your health insurance company. If you have private health insurance and you have a chronic health condition, most, I'm not gonna say all because there could be limitations, but most private health insurances have a case manager that can begin to manage your case. That means if you are For example, working on authorizations for durable medical equipment, and let's say it got denied. That's a battle for you to fight on your own, right? Trying to demonstrate the need. But if you have a case manager that's working with you and is helping you manage your services through the health insurance company, they can be your advocates. They know your story already. So you're not repeating the same thing over and over again when you're calling your health insurance company to several people. So this person is sort of assigned to you so that they can advocate for you and help you negotiate those um, approvals for DME or home care or anything else that you may need at that point. So that's why I pointed case management services. Medicare also pays for case management services. For example, as a social worker working in an outpatient setting, I provide case management services for people with Medicare. So, if, for example, a lot of people with Parkinson or MSA that need support in managing those services, I help connect the patient and the families with support services. I will be your advocate with Medicare to try to get something approved, and then I'm working with the physicians in trying to get the documentation that Medicare needs in order to approve it. So that's how case management can help you. Okay. Any other questions?
For someone who's not on Medicare, younger person,
Mm-hmm.
private insurance, how do they get services for disability? What recourse do they have?
With private insurance, what do you have in mind specifically in terms of services?
Well, this is a case where he needs speech therapy, occupational therapy, physical therapy, and he's not getting any of those services because the insurance that is in effect is not going to pay for.
The insurance is denying all those services, and he has been diagnosed with MSA, and he has MSA, and he has the insurance company been contacted and determined what is it that they need?
Denying any services that were advised in the.
Okay, so the first thing I recommend is definitely talk to your physician and make sure that they're documenting what needs to be documented. It, it can take, it depends. You first of all have to be familiar with your insurance company. What are the benefits? Make sure that you understand what are the benefits based on the level of coverage that you're getting from your insurance companies. But skilled care is basically it's a given. If you have insurance, home PT, if you're able to prove the need, you should be able to get it relatively easily. If you're getting appropriate documentation, if the insurance company is getting what they need to in order to approve it. So make sure that there is appropriate documentation, that your physician is writing a script with the appropriate diagnosis codes.
Go through the physician.
Yes. Make sure that they're writing the appropriate diagnosis codes. Sometimes a code, a number, then makes a denial. So make sure that that's ready. Make sure that the plan that he chose has coverage for that type of service. You can also inquire about case manager within the health insurance company that can help you navigate those denials. So those are some ideas, because private insurance should be paying for these services, especially with his diagnosis.
It's under his wife's insurance. So
Yes, it doesn't matter. Yes, it does.
They're not, because they won't cover it, if you're not homebound, they won't cover any in-home, they'll only cover outpatient.
That is a very good point. Yes.
So if you want OT, PT, if you want all that stuff, but you're not homebound, they will not cover someone to come to the house.
The insurance company should tell you why they're denying him. That's another thing. They need to tell you whether it's because he doesn't qualify because he's not homebound, but they need to tell you why. So it's important that you know that. Okay. Anything else? Compassionate allowance. People, anybody applying for Social Security? You guys have Social Security already in place through compassionate allowance. Compassionate allowance was created so that people with chronic conditions or serious health conditions can get Social Security in a minimum amount of time. So if you start an application for Social Security, it could take a few weeks, to get approved. If you have your documentation, in reference to your medical diagnosis, proof of all the medical exams, doctor's visits, MRIs, whatever is imaging that they need to diagnose the condition. And you need to also qualify based on your income. If you're able to provide everything that they need to approve the application through compassionate allowance, it can be approved really, really fast in a few weeks. However, you will begin to get benefits for Social Security. You do have to wait about 5 months until you get the financial support coming, and you do have to wait 2 years for Medicare to kick in. So even under compassionate allowance, those rules still apply. Any other specific questions? What about respite care? Respite care, it's really important. So what is the concept of respite? It's pretty much a break to the caregiver. And why is that? Why do we need breaks? you know, we can do it all. So, but we do break. We need, it's important, especially because we know it's a condition that it's ever changing, that is very hands-on as it progresses, and you need to take care of yourself as a person caring for someone with MSA. And so there are options. Respite care it can be paid, obviously, private pay. But if you are receiving Medicaid benefits and you have services such as MLTSS, you can qualify for respite care services. There are grants out there as well that offer services for respite. The statewide respite care program, it also has information on how to get grants on respite, and the Aging and Disability Resource Connection is kind of the point of entry to find out what grants are there in terms of respite care. And respite care can be in-home respite, meaning getting somebody in home a few hours a day, a few hours a week, so that you can go food shopping, or do whatever you need to do at home. Or it could be out-of-home respite care, so that, for example, adult daycare programs are an important resource for respite, because the person can be out of the home, being cared for, actively participating in activities, and then in the meanwhile, you can do what you need to do to recharge and make sure that you can continue to your job or your role as a caregiver. So respite care is also very important. Any other specific questions? So we talked about travel. For safe travel, the Transportation Security Administration actually has a helpline. I have the helpline number there. And then they can actually help you at the airport. If you call them 72 hours ahead of time, they can help you at the airport and walk you through the process of checking in and getting, going in the airplane, and managing all of that you need to manage in an airport while you travel. And there are, I do have the website listed there. And I have additional resources at the end of the slides with 3 additional places where you can find information on travel. So there is a lot of information out there to look for. POLS. This is about advanced directives. Is people here familiar with POLS? So the POLS, Practitioner's Orders for Life-Sustaining Treatment, this is part of long-term care planning. And this is something that the physicians at the beginning of the talk, they were talking about the importance of long-term care planning. So the POLS doesn't replace your advanced directive. The difference with POLS is that it is a medical order. So that if you sit down with your physician and you fill out a POLS, a Practitioner's Orders for Life-Sustaining Treatment, if in the event that something happens to you at home, there is a medical emergency at home, EMS comes in to help you out, and you have POLS, and the POLS have strict direct orders from your physician. These are the things that we're going to do in the event of an emergency. These are the goals that the person with MSA has in terms of their care and their quality of life. So the EMS people will follow those orders. So there is no wasting time in trying to get the doctor, to find out what to do, because there are already clear orders there. So it's a very important document to have. It's a really interesting conversation to have with your physician. It's a green form. They made it green specifically because they want to stand out from all of the other forms in your chart. So in medical records, I mean. So it should be part of all of your medical records. It should travel with you wherever you go. If if you are home, if you happen to have a hospitalization, it should go there. If you need to go for inpatient rehab, it should come with you. So it's an important thing to have in mind when you're planning. I talk about, I mentioned the assistance of elder care attorneys, because when you're thinking about long-term care planning and you are thinking, okay, how we're going to afford care for long-term, resources are running short, or we have a little bit too much money to qualify for Medicaid. So how can we take care of our finances and save some of that money without being penalized for it in the 5-year lookup for Medicaid? Elder care attorneys can help you create funds legally that are accepted under the federal law that could not be touched, and you can keep that for for whatever other purposes you have, but you need to do that on time. You need to plan for those as well. So elder care attorneys, if you cannot have assets and you don't really know how to make sure that we're planning for the future, they can really help you create that roadmap. And I heard from people that have used elder care attorneys for long-term care planning that it has lifted big weight from their shoulders, just because of there is a clear way to what we need in the future. So you have my contact information is there. If you have any questions or concerns, just reach out and we're here to support you. Thank you for staying, guys. Thank you.